Hello, everybody. Welcome to this training on naloxone, or also known as NARCAN, response to opioid overdose. The staff of Seattle Mennonite Church went to a Train the Trainers event a little while back that was organized by Catherine, director over at GLA. And so this is our attempt, because we are supposedly now trainers. This is our attempt to now train the rest of y'all. We're going to keep it as simple as possible. And I'm going to hand it over to Melissa to be kind of our lead. And all of us are going to chime in along the way. And thanks for taking the time to do this. All right, Melissa.
Hi. So we have placed around the church in about 5 different places, boxes that look like this. They have NARCAN stickers on them, and inside of them they have instruction sheet that's going to have everything that we tell you today, laminated, an actual naloxone kit, so that actually has the nose spray in it, gloves, and wet wipes in case you need to clean up the person or the scene in any way. So I could go to the next one.
All right.
So what we're going to cover is what are the signs of an overdose and how do you use these kits. Basically, it is very basic, actually. And then a little bit of just sort of explanation of why we're at this point at all, what's going on with the opiates and opioids and fentanyl and risk factors for overdose. And then we're going to review it one more time. What do you do if you find someone that you think has overdosed? Next one. So NARCAN or naloxone, which is a nose spray, or the way we're going to administer it would be a little nose spray thing, works for overdoses on opiates and opioids, which would be like heroin, fentanyl, oxycodone, OxyContin, Percocet. It does not work on overdoses with cocaine, meth, Valium, alcohol, muscle relaxers. It won't do anything for those because it's very specific to the opiates and opioids. Slide.
But also they told us it doesn't do any harm.
Right, it just won't do anything because it just works on a particular receptor that the opiates and opioids work on. So it won't do any harm. But if you know what the person is overdosed on, that would be helpful. There's no point in giving this to someone that's just drunk or just took a bunch of, they just took a bunch of cocaine or something. It won't work.
Yeah, but if uncertain, go for it.
Right. So what an opioid or opiate overdose looks like is someone who's having trouble breathing and trouble staying conscious. So you might come across someone who's just completely passed out and having a hard time breathing. So it's going to sound like very labored breathing. It's a very particular kind of breathing sound. The opioids work on what are called mu receptors in the brain. And so they decrease pain, which is why people take them, because it does make you feel better for the rest of sort of the world, but it also decreases your breathing and decreases your consciousness. So that's why an overdose looks like someone who can't stay awake and can't breathe. It also increases euphoria, another reason that you would be taking them. But yeah.
And maybe you're getting to this, but you are getting to it. I was going to say, what does it look like?
Yeah. So you've come across someone who's passed out, having a hard time breathing. It's going to look like blue fingernails and blue lips for someone with fairer skin, and maybe ashy or white lips for someone with darker skin. The struggling or no breathing going on, so kind of a death rattle or a weird snoring sound, or you can just tell they're really laboring in their breathing. And they're going to be unresponsive to external stimuli. So yelling their name, yelling at them is probably the first step to see if they'll wake up and it's something else going on. If not, you can do the sort of the rub or really hard tap on the sternum. So you use your knuckles and you rub really hard for about 5 to 8 seconds. And if they are at all capable of consciousness, they will respond to that because that hurts. If you're doing it right, it's going to hurt. And shaking them. So just, try to rouse them. And if you can't, then, next step is to go probably, you're going to want to call 911 if you have your phone right with you. If you don't, go grab the kit and then worry about finding your phone. There are maps around the church, mostly by the doors into the church, the external doors, that will tell you where the kits are. But in our church, they are there's one by every sink. So each of the kitchens and the youth room that have sinks each have a kit. There's a kit in the prayer room and there's a kit in the copy room. And they're labeled on the outside of the cabinets. It says like NARCAN kit here. And in each one of them, there's a little square box that's like the mailing boxes that the NARCAN kits came in with their stickers and everything. So call 911, tell them you've got an overdose if you've got your phone right with you. If you don't, go get the kit and administer the naloxone, and we'll go over how to do that in a second. And if at all possible, reach out for someone to come be with you and help you when you're responding to this, because it would be helpful for someone else to call 911 if you're actually having to deal with this, and then having someone around to help you make judgment calls also helpful. Again, read our handy dandy laminated card to you, make sure you're doing all the steps. Okay, so how to administer the naloxone. In our church, most of these little boxes are still closed. We have at least one that we've opened the cardboard box. There's 2 little nose spray kits. So what you want to do is make sure each one of these is 1 dose. So you only have to open 1 to start off with. You want to make sure the person's laying flat on their back. You want to tilt their head back so that you can get the naloxone into their nose and it's not going back down their face immediately or anything. You push the naloxone little thing up 1 nostril all the way to your knuckles. So get it in there good. And then you push hard on the plunger. And I've given these kinds of little thingies before, not naloxone, but other kinds of drug things. And it doesn't feel like when you're used to doing nose spray that's got a spring to it. It doesn't give you any spring back. It's just like pop and it's in. There's so just shove it all the way in. Each plunger is 1 dose. So if they're not breathing, now's the time to start doing rescue breathing for them. And the instructions for how to do rescue breathing, I believe, are actually on the card as well. Possibly not. It's, what is it, guys? 1 breath every 5 seconds. Is that right?
Oh, I need to go look at my notes. Anybody recall?
I was thinking of, no, I'm not even going to hazard a guess.
Why don't we circle back to that? I'll look it up in my notes. When we go through the review the second time, we can confirm rescue breathing.
You do that for 3 minutes. If they still aren't responding, you give them the 2nd dose out of the box. You give them the 2nd little nose spray thing. The same procedure length, making sure they're still flat on their back and that their head's tilted back far enough. And get the spray in.
I got it.
Yay.
Rescue breathing, tilt the head back, pinch the nostrils closed, 2 short mouth-to-mouth breaths, and you're looking to make sure that the chest rises so that you can actually see the breath going into the body. If the chest does not rise, then there is something off. And so you might need to sweep the mouth. Sometimes there's vomit or something else. That's why the handy wipes are in there to sort of sweep the mouth. Sometimes it's also just the tongue, right? Didn't we?
Yeah. And sometimes you don't have their head tilted back correctly. So you might need to just straighten their head back out and then tilt it back. When you tilt the head, it's usually easiest to put 1 hand on the forehead and 1 hand under the chin and lift back so that their airway is open. And yeah. And so
then once you confirm that it's actually going in, then it is 1 full breath every 5 seconds.
What? Former first aid teacher pulling that out of nowhere. Okay.
I remember the other thing was that chest compressions really don't work because what we're trying to do is get the breathing going again. So you can't do the heart attack chest compression piece and expect the same results.
Well,
right?
Also 911 should have been coming by now. So you administer the naloxone. If you didn't call first, you call immediately then and then do the rescue breathing, and they should be coming pretty darn fast. That's the other reason to just stick with getting oxygen into the blood and letting the rest of it go as it will. Okay, so if they wake up, stay with them. Naloxone is going to wear off in 30 to 90 minutes. They're probably not going to be super happy. Don't let them use any more drugs. They were using the drugs to feel better, and the naloxone goes in and kicks the opioids out from the active receptors. So they're going to be cranky and not feeling good, but they're going to have that still in their system. So they shouldn't be taking any more drugs. And if you're not sure about their condition, if they seem really shaky, take them to the emergency room or wait for 911, who hopefully should be on their way, since this is the church and we're going to be calling them and the fire department's like 3 blocks away. They should be there real quickly. If you have to leave them at any point in all of this, like to run, get your phone to call 911 or go to the church phone to call or whatever, if you have to leave them, you need to put them in the recovery position. And that's the next slide. Because this is what's going to keep them from choking on their own vomit or something like that. So you have them on their side. As you can see here, the top leg that's not on the floor is you bend it at a 90-degree angle to keep them from smushing down onto their face. And then you can see that the arm that's on the top, also you take that hand and put it under their chin. So that also keeps them from rolling and keeps their head in basically the right position to be breathing, which is a big deal. So why are we even having to worry about this? And what is this whole opioid thing? So opiates have been around forever. They're the derivatives of the opium poppy, morphine, codeine, heroin. Those drugs have been around a long time. And if you have an overdose with them, this is still the same response. But there's also these opioids, which are now, these are synthetics that have been made, and some of them are hugely powerful. They work on the same part of the brain that the opiates do. So we're looking at fentanyl, oxycodone, methadone, hydromorphone. Both types, opiates and opioids, work on the mu receptor, as does naloxone. So what naloxone or NARCAN does is it kicks the opiates or the opioids off the receptor and binds there and keeps them from doing anything for 30 to 90 minutes. The reason that's a really big problem right now is fentanyl, which was created to treat breakthrough pain, so pain that you keep having even if you've taken other meds. So it's the pain that meds are not touching. And it's very, very strong. And it's basically, I mean, Catherine, the head over at GLA, was saying months ago, like, that their clients just assume that all of the street drugs have fentanyl in them. They have some amount of fentanyl. They don't know how much, you know. So it's increasingly in multiple different kinds of drugs, stuck into various different pills, various different whatever they're taking. And people are using more multiple drugs right now. So it's a more common thing than it used to be for someone to mix drugs. So they can be getting fentanyl from multiple different drugs, which is problematic already. Fentanyl deaths have doubled in Washington. They doubled in Washington from 2019 to 2020. So they're in a huge rise. And part of the reason is because it's in everything. And then the other problem is, next slide. It only takes a teeny tiny amount for a dose. So one dose of fentanyl is 100 micrograms. So that little packet of sugar represents 30,000 doses of fentanyl. So there's no way you're measuring that out without like professional lab grade weighing equipment, which no one on the street is going to have, right? So like one little grain of sugar is 2 to 3 doses of fentanyl. And so they're going to have a hard time measuring it out. It's in all of the drugs, and it doesn't mix evenly through whatever other drugs it's in. So on any given dose of some other drug, you don't know how much fentanyl you might be getting. If you're splitting the drug up amongst yourself, amongst your group or your friends or whatever, you can have one person get all of the fentanyl that happened to be in that pill, and everybody else get none, but that person's got 10 doses because they got 2 grains of fentanyl or whatever. You know, it's very hard to eyeball this. There's no eyeballing this, but even if you could see it, right? Which mostly they can't anyway. So this is why it's a problem. This is why people are dying in huge rates, because we've got this drug on the street that is difficult to use casually in any way. Right. So the risk factors for an overdose, just for review, just so you can see again why this might be something that's on the rise. So periods of abstinence increase your risk of an overdose from any of these, not just fentanyl, from any kind of opiate or opioid. So at the end of therapy, where you've gotten off of it or released from jail or prison, one try and you can be overdosing because your body's not ready for it. The polysubstance use, so this issue of using multiple different kinds of drugs or alcohol plus something, or one of the other kinds of drugs that our NARCAN doesn't work on, but they mixed in with an opiate or something. If you're using a drug that you have to redose constantly to keep the high, and fentanyl definitely does that, it doesn't last very long. The high doesn't last long at all. I think he said like half an hour or 15 minutes, like it wasn't long at all.
I thought it was like 15 minutes. It's very
Yeah, yeah.
because it's meant to get that breakthrough pain. So it happens fast, quick, intense, done.
And then it's gone. If you're using alone, if they're using alone, if there have been overdoses in the past, that's a risk factor. And then any other kind of ailment puts you at a risk for overdose as well. So, and anyone who's living out on the street almost certainly has other ailments besides whatever their addiction is. So they're all at significant risk. So I'm just going to review again what it looks like and sounds like when someone's had an overdose and what we do. So it looks like blue fingernails and lips for someone with fairer skin, ashy white lips for someone with darker skin. They're having a hard time breathing, and you can often hear it. It sounds, they say once you've heard it, you don't forget it. That's what they said to us in our training. I believe that. And then unresponsive to external stimuli, like yelling at them, yelling their name, doing the pain rub on their sternum, shaking them. That's a clear sign of an overdose. So you look for the overdose signs, including checking to see if they respond. So you don't just jump right in with any kind of treatment. First, make sure that they're not just sleeping really heavily. Call 911 if you can immediately, but the important thing is to get this NARCAN into them as fast as you can. So if the phone is not immediately available, grab the kit and get the NARCAN in and then go call 911. Call for somebody to come help you. As many people as possible. But yeah, I'm assuming if you're at the church, there will be someone else around that you can yell for that will come out and help.
I have a question that maybe you all can help me remember. If we call 911, will we say, I'm here with someone who I believe has overdosed on opioids, I'm administering NARCAN? Is that the information that you want to give to 911?
Yes, that is actually on the little laminated card.
Okay.
To tell 911 that that you're either administered or getting ready to administer NARCAN, so they know. If you stay with the person, you'll also need to tell them that again, probably. So each of these boxes comes with 2 doses. Make sure the person's laid out flat. Get their head tilted back for the administration of the, this helps, but I'm not sure if you have to do it as far just to make sure that the nose spray goes in. But the rescue breathing one was definitely that. Get the naloxone all the way into the nostril, all the way up to your knuckles. Push hard. It's got a red plunger, easy to see. Push hard. Each plunger is a single dose. So do 1 and begin the rescue breathing, which is then definitely make sure their head is tilted back, that you pinch their nose hard. You don't want air escaping out the nose when you're trying to get it in the lungs. 2 quick breaths, watching the chest to make sure that it actually moves when you breathe, readjusting everything if it doesn't until it does move. And then continuing the rescue breathing for 3 minutes, just decent amount of time, but it's not that long. And if they haven't come around and started sputtering, telling you to help them find their stash, give them the second dose of NARCAN right then, and hopefully go back to the rescue breathing, and hopefully the paramedics will be there post haste. It takes 30 to 90 minutes for the naloxone to wear off. Don't let them use any more drugs. They very well may want to. They may not be very nice about this whole thing either. They're not going to feel good. And if you're not sure about their condition, get them to the ER or get the paramedics to them or what have you, because they may need to be observed for a while. If you have to leave them for any part of this, put them in the recovery position on their side, top leg at a 90-degree angle so that they don't roll over on their stomach, top arm, put the hand from the top arm underneath their cheek, and go do what you need to do, and then get back to watch them. Thank you.
Awesome.
Can
Before we
we-
close out, I'm going to put it on speaker view. So Melissa, you can hold that stuff up again while your face is big and people will be able to see it a little bit better. And then what were you saying, Amy?
I was going to ask exactly for the same.
Oh, there we go. Great minds.
All right. So these are the kits that are all around. And they've got, this is the main thing you really need, the NARCAN. And it's got 2 little nose sprays in it.
Did you
But
pull
it
one of
does-
those
it
out?
will-
It's helpful to see the plunger. Pull one of those out.
Sure.
Oh, yeah.
Like that. One
You
dose.
really got to get it in there deep. Like that's,
And then the red plunger is the thumb below. Yeah.
yeah.
Yeah. Thumb goes on. But well, it's not as deep as it looks because your fingers are going to be up at the top.
That's true.
You just have to
Yeah.
get it to your knuckles. So yeah. I did that for Madeline with migraine medicine. It wasn't painful. It wasn't like. And then there will be a laminated card that has a little miniature version of all of this on it. So you can just step by step go through it.
Excellent. Thanks so much, Melissa. Anybody else have anything to add?
I'd just like to say that when you're administering the naloxone, you don't know how they're going to wake up. So I would be standing off to the side, and as soon as you press that plunger, get it in, move around to the back because they may wake up swinging, and you don't want to be in the front to get hit. So it's important to make sure you're out of the way because you don't know how they're going to wake up.
Another good reason to have a companion if you can.
That's right. The other thing is if with rescue breathing, if you don't have good success with the chest rising on the breath, tilt the head, lift the jaw up, try and lift the jaw up even more. It'll release the tongue to come back if that's what's blocking it. But a lot of times just adjusting the head and the jaw, it'll open the airway. It'll open the airway.
Great. All right. Is that a wrap?
That's a wrap.
Way to go, trainers.
Well
Good
done,
job for SMC
Melissa.
Staff. Thank you, Melissa, and everyone for leading us. Okay, I'm going to stop it now.
Okay.